So if a patient has had fillers for a liquid facelift, and they're at that stage where it's just not working for them anymore, and it's time for the real full-fledged surgical facelift, can you do that with fillers already in the face, or do you want to wait till they kind of go away? What's your process on that?
No, you can, and the reason you can if you're using the right technique. So if you're just pulling on the skin and redraping the skin, then no, you really need everything to atrophy to at least see how hard or how much to pull on the skin, even though I've already shared with you that I'm not a big fan of that. If you pull on the skin, what does the skin tack to? It tacks to the cartilage of the ear and the earlobe. So what happens when the skin relaxes, as it always will? It pulls on the cartilage of the ear and the earlobe, and we've all seen the results of that. So, but if you're lifting the deeper layer, you're going to lift that, and you take the slack out. So it's not a matter of how much or how little. And it really takes that away. You put it back where it belongs. So there's a right place in that case, and that really takes that judgment out. So yeah, you can forge ahead.
So if a patient has a facelift, they've had filler in their face before, you go ahead and give them the facelift. They're then in a year probably going to need to volumize again, right?
It depends on how much volume they had in and how much fullness they want. Let's sort of cards on the table. I haven't met a person over 35 or 40 who doesn't look good if you take a half a syringe of Juvederm, whether it's Juvederm Ultra or Juvederm Voluma or Restylane, to be fair company to company, who doesn't look better if you put a little filler in the cheekbone, okay? That's just the truth. So, when you talk about whether a patient needs filler, it can be a very relative term. Again, I've had patients with extremely thin faces, and we've been able to give them cheekbones, under the eye fullness, contour of their jawline through the lifting. Does that mean they wouldn't benefit from a syringe or one or two syringes of filler in the cheekbone area or maybe the corners of the mouth? Of course not. They can always complement that. But with the proper lifting, you can get them 90% of the way, that's for sure.